Welcome to Monday's edition of COVID-19. The daily tally has been hovering relatively high despite the fewer tests over the past weekend, fueling concerns over the trend of the spread here on the local front. Now, we have details on that later on in the program. Here first are the pandemic updates with our Kwon So-ah. So let's begin here on the domestic front then.
Sure, Sunny. We've got a drop by more than 100 COVID-19 infections this Monday compared to the weekend figures. 501 cases were reported as of 12 a.m. on this last Monday of June, and that includes 472 domestic transmissions and 29 cases from abroad. So with that, the total number of cases in Korea stands at 155,572. Now, since last Wednesday, Korea's figures were in the 600s, and then we have dropped down to the 500s now. But 501 is not a low figure if we consider that it's a Monday, because we usually have fewer testings over the weekend, and that's also why we actually recently even went down to the 300s, which is why we still have to monitor the rest of the week. Now, this Monday, the capitals Seoul and Gyeonggi-do province have reported triple-digit figures, and over 30 cases were reported in Incheon as well as down in Busan.
Right, and depending on their respective COVID-19 situations, these regions, I understand, are poised to look at new levels of social distancing in July.
Exactly, Sunny, and that would already be Thursday later this week, with the government having announced on Sunday that level 2, according to a revised social distancing system, will be applied to the capital region and level 1 elsewhere. Now, under the current 5-tier system, Seoul, Gyeonggi-do province and Incheon are under level 2 and will be under level 2 under the revamped 4-tier system beginning July 1st, while other places that are under level 1.5 will be under level 1. But the relaxed system won't kick in at once.
Most local governments are planning to ease restrictions through a 2-week transition period to prevent complacency from settling in. As Seoul is dealing with a particularly large outbreak, we are consulting with experts to strengthen our containment measures, which we will announce as soon as a decision is made.
As part of the 2-week transition period, the lifting or easing of private gathering restrictions will also come in a gradual manner, as you can see here, with the Greater Seoul area to allow up to 6 people to get together for 2 weeks, and most places outside the metropolitan region will allow up to 8 during the transition period. Also, a few exceptions are Jeju Island, which will go with the same rules in the capital region for now, meaning private gatherings of up to 6 people, whereas Chungcheongnam-do province in central Korea has decided to lift restrictions beginning with the new system. And the southeastern city of Daegu is still considering what to do, with an announcement slated on Tuesday. And let's move on to our vaccination updates. We usually have fewer vaccinations over the weekend, but we now have almost 15.3 million people who got at least 1 dose. That's 29.8% of the nation's population. And vaccination is especially being stressed at this point due to the spread of the Delta variant, which the World Health Organization now is calling the most transmissible strain identified so far. And that variant is also the reason for resurgences in countries like the UK, Russia, Israel, and Australia. Now, Israel and Australia currently have 840,000 and 30,000 infections respectively, while the other two I mentioned, Russia here and the UK, have 5.4 million and 4.7 million cases each. And in the past 24 hours, as of noon Korea time, over 315,000 new COVID-19 cases have been posted around the world. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
Right, so I'll see you back at the desk then. Right, one common call on people amid the pandemic has been to stay at home and to avoid unnecessary ventures outdoors. But what do these words mean for the homeless? We answer that question and more in this report.
The summer heat has arrived, but the homeless can still be seen wearing their heavy winter coats in street corners all across Seoul. Many homeless citizens have flocked to this welfare center in central Seoul, where free water bottles and face masks are being handed out. Regular exercises in disease prevention, such as hand washing, social distancing, and the frequent changing of masks, is a challenge for the homeless, which the center is looking to address through its community outreach programs.
더운 날씨에 온열 질환이나 다른 기타 감염병 예방을 위해서 저희가 물과 마스크를 같이 지급을 하고 있고요. 항상 아웃리치마다 넉넉하게 챙겨서 이렇게 나눠드리려고 저희가 하고 있습니다. 마스크 지금 더러우신데 또 더 갖고 계신 거 있으세요? 네. 많이 갖고 계세요? 네. 한 2장 더 드릴게요.
So what are some of the other difficulties being faced by the homeless amid this pandemic?
무료급식소라든지 어떤 노숙인 시설이라든지 그런 것들을 이용을 하시려면은 이제 코로나 검사를 일주일에 한 번씩 꼭 받게 좀 되어 있어서 그런 규정들 때문에 많이 불편함을 겪고 계시고요.
Access to homeless shelters has now become more limited, as entry is only allowed for those with a negative PCR test result.
핸드폰이 없으시면 이제 코로나 검사를 받아도 결과를 확인하기 어려운 상황들이 있고 저희 희망지원센터에서 노숙인분들 이제 그 검사 의뢰서를 이제 보건소로 끊어드리고요. 그러니까 가깝게 서울광장에 이제 선별검사소에서 검사를 받으면 그 결과를 다시 저희 쪽으로 좀 보내주시고요. 그럼 그 결과를 받는 대로 개별적으로 이제 결과 확인서를 좀 나눠드리고 있습니다.
More people have also been forced out onto the streets due to the economic fallout of COVID-19.
코로나19로 이제 일용직 같은 거 하시다가 일자리가 없어져가지고 이제 거리로 나온 사례가 이제 발견이 됐어요. 실직이 된다고 바로 거리로 오시진 않는데 이제 고시원이나 쪽방같이 불안정 거처에 사시던 분들이 이제 코로나19 여파로 거리로 나왔을 가능성이 좀 있다고 보고 있습니다.
The homeless population has also risen in the U.S., and the problem has been aggravated by people avoiding the close living quarters afforded by the shelters.
The pandemic was clearly a serious problem for homeless people because, at least in New York City, the majority of them live in shelters, and the shelters are very close, dense, and not safe places. There's no room for distancing. They're not safe. They're not hygienic.
Many countries around the world are now providing temporary living spaces for the homeless to better contain the spread of COVID-19.
The ultimate solution is housing and more affordable housing for homeless people. So I think that's the recovery.
The city of Seoul is looking to fully vaccinate the majority of its homeless population by the end of July. More than 2,300 homeless people in Seoul have already gotten their first shot, with their second doses lined up in July. This welfare center is doing its part to help with the vaccination process for the homeless, while providing them with information on shelters and prevention to keep them safe in the meantime.
안내를 통해서 저희 115 잠자리 이용할 수 있는 그런 시설과 또 이제 임시주거 지원 연결을 해드렸고요. 다만 답답함 때문에 거리 노숙인을 또 유지하신 분들이 계십니다. 그분들에 대해서는 거리 아울렛을 통해서 우리 실무자 상담 선생님들이 한 번 한 번 좀 찾아뵙고 이상 징후가 없는지 계속 좀 체크를 하고 있습니다.
The homeless are some of the most vulnerable members of our community, and we must ensure that they're not left behind in our vaccination and prevention efforts.
It's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Monday. As mentioned earlier, come Thursday, that would be July 1st, COVID-19 restrictions will be eased nationwide, with the Greater Seoul area to face Level 2 social distancing guidelines and most other regions Level 1. For 2 weeks, though, starting on this Thursday, authorities have chosen to ensure that their guidelines will be tweaked given the current concerns over their daily infection numbers in these regions, that is. A total of 6 people will be able to gather for social purposes as opposed to 8, which is the actual maximum number for regions under Level 2. But immediate family members face no restrictions under Level 2. Also, should daily infection numbers hold steady, the capital area will be able to enjoy complete implementation of Level 2 guidelines starting from July 15th. Right, the briefing's about to start. We'll come back to you afterwards.
I am the head of the team in charge of the epidemiological investigation, and let us now begin our regular briefing for June 28th, Monday. First of all, on the vaccination front, here are some details for the weekly analysis. As of today, midnight, we have the number of those who have received at least one COVID-19 vaccine dose standing at about 15,290,000, which is about 29.8% of the total population. Out of them, 4,643,951, or 9% of the total population, have received are now fully vaccinated. And as for those over the age of 60, we have about 80% vaccination rate and 85% vaccination rate for those in the 70s as well. And starting from today, we are also receiving these vaccination bookings for these essential social workers who have not received their vaccine dose earlier. And we are going to open the booking process for the next 3 days. And you can do so via our webpage. And regardless of your residential address, you could also designate the place of a vaccination center. And please utilize this appointment schedule and please get vaccinated as well. And next, as of the COVID-19 vaccination drive, we also have some post-inoculation adverse responses, and here are some weekly analyses of these factors. And also, out of some 18 million doses that have been rolled out, we have about 85,149 cases of the adverse responses being reported, and out of them, about 95.1%, that is, were mild or common symptoms, and the rest were also deaths or severe cases including anaphylaxis and so forth. And as for the deaths that have been reported, we have a total of 335, and 142 were AstraZeneca vaccine recipients, 1 Janssen vaccine recipient, and 0 Moderna recipients. And yes, last week, looking at the numbers last week, we also have the rates of these reports of the adverse responses being about 0.01%, and the immediate previous week was about 0.04%, and we have seen a slight decline. And in order to ensure a safe COVID-19 vaccination, we would like to update you on some precautions. All of the recipients, after receiving the vaccine dose, you need to stay at the vaccination center for the next 15 to 30 minutes and monitor your symptoms. And even returning home, you need to also monitor your symptoms for the next 3 hours. Moreover, after inoculation, for at least 3 days, you need to take particular precautions and also watch your conditions. And if you feel high fever, or also if you have some discomfort, you need to also visit a doctor as soon as possible. And if you experience symptoms of anaphylaxis or severe allergic reactions, you need to call 119 immediately or visit an ER. Moreover, as for AstraZeneca and Janssen vaccines, as for these types of vaccines, if you have administered with these vaccines, you could also witness some symptoms of the blood clots within 4 days and 4 weeks after inoculation. And if you have such symptoms, you need to visit a doctor as soon as possible. And all of the medical doctors who have such patients, you need to also report the latest updates to us. And also, after inoculation, if you experience severe headache or difficulties in breathing or swollenness in the legs or arms, please also be suspicious of possible symptoms of these blood clots. And after inoculation, if you also experience severe headaches for the next 2 days or so, which is not controllable, even after taking painkillers, you need to also visit a doctor as well. Moreover, if you have bruises or swollenness in the injected areas, you should also take particular notice as well. And as for anaphylaxis and deaths, we have also some screenings that have been done in order to identify the relations with the vaccines. And we have done a total of 19 rounds of our compensation task force team meeting. And as of now, we have looked at about 553 deaths and also about 243 anaphylaxis cases. And among them, out of all of these, we have seen 92 cases having the relations with the COVID-19 vaccine. And in this 19th screening meeting, we also have looked at about 42 deaths and 59 severe cases, and a total of 43 anaphylaxis suspected cases as well. And out of the 42 deaths, the average age was about 79.9. And also, as for Pfizer, there were 30 people, and 12 people received the AstraZeneca vaccines. And by having a comprehensive review, 41 cases had no correlation with the COVID-19 vaccine. And also, most of these cases were acute heart diseases and sepsis, or also myocardial infarction. And we saw that instead of the vaccines, we saw that these underlying illnesses and medical conditions have incurred such deaths. And out of them, one case, we are also going to have another round of screening after autopsy. And as for 59 cases of severe cases, the average age was about 72. And also a majority of them had underlying illnesses. And it took about 7 days in average to show these symptoms. And 43 received Pfizer vaccines and 15 AstraZeneca vaccines, and 1 received the Janssen vaccines. And 56 severe cases, we have seen the comprehensive reviews, and we saw that 56 cases that were subject to review did not have any correlation with the COVID-19 vaccine. And as for the 3 pending cases, we will be looking at supplementary and complementary and supplementary data and materials to also have another round of screening. And also we looked at 43 new anaphylaxis cases, and we have seen 16 cases to have the correlation with the COVID-19 vaccine. For the past week, here are some updates on our COVID-19 outbreak. The daily average domestic infections here in Korea stands at about 492.6, which is about 10.6% increase from the previous week. And in the metropolitan area, we have seen related cluster infections stemming from the cram schools and so forth. And aside from Jeju Island, we have seen an on-week rise in the weekly infections. And as for the imported cases, our daily average stands at about 42.3 cases, which is about 56% increase from the previous week. And our additional death for the past week stands at about 10, and our fatality rate is on a steady decline. And for the past week, we also have some multi-use facilities and religious centers, and also cram schools and workplaces and families that are also the subjects of the cluster infections. And we have also seen a slight increase in the cluster infection stemming from nursing hospitals and so forth. And as for the risk factor for the past week, here are some details and our responses as well. With the revamped social distancing measures starting from July 1st, we will be easing the attendance gap and the cap that is for the private gatherings, and we believe that there could also be an increase in the number of contacts as well. And to this end, it is very important that we also bolster our testing capacity if you have any symptoms, and we also encourage people to get tested, and we need to also have the doctors and pharmacists to also encourage people to get tested if they have any symptoms. And also at tourist destinations, we will also intensify our monitoring as well, and we will also intensify our regular testings as well. For the past week, we have seen the increase, and here are our analysis of these factors. And for the past week, we have seen clear differences in the age group. For those over the age of 60, we are seeing a steady decline in the number of patients. On the other hand, in those age groups below age of 60, we are seeing an increase in the number of infections. And most of these age group have not received their vaccine yet. And this means that as for the senior group of citizens aged over the age of 60 who are vaccinated right now, they are seeing a decline in the number of new infections. However, we are also seeing continued infections breaking out at the lower age group. And for the past week, we also saw those between the age of 20, those in their 20s were the majority of last week's infections. And about 554 cases were in their 30s. And those in their 20s had the largest on-week increase. And also this was an increase by 112 from the previous week. And as for the sources of infection, we have seen that most of the cases were related to cluster infections like restaurants and pubs and bars. And those aged between 40 and 50, they were stemming from friends and also office spaces as well. And until we reach herd immunity, it is very important that we wear face masks at all times and also have regular ventilation and also get tested if you have any symptoms. So once again, we highlight these aspects. And next, as for the new variant cases, here are some details. And for the past week, we have identified additional new variants, and the number now stands at 267, and 189 were Alpha, Delta, 1, Gamma. The Delta was 73, and also 1 Beta case. And we have seen that 196 were local infections, and the rest being imported cases. And in Gyeonggi-do province, 48 cases, 28 in Seoul, and 22 in Daegu. And also, as for the major cluster infections, we have 26 new cluster infections, and 22 of Alpha, and 4 were related to the Delta variant. And as for these new cluster infections related to these new variants, we have seen 390 cases, and on average, one cluster infections infected about 15 people. And starting from the 4th of May, we have also our continuous flying from India, and we have more than 3,400 people returning back to Korea, and out of them we have seen 82 COVID-19 cases, and out of them 22 new variants have been confirmed. And we also see at nightlife entertainment venues and pubs, we are also seeing a large cluster infections stemming from these areas. So here are some precautions that we need to also highlight. And for the past several months, we have also seen 19 new cluster infections stemming from these facilities. 14 were nightlife entertainment venues, and 5 were bars and pubs. And in Jeonnam, Suncheon City, we have a pub there, and this was a major case, and we have seen one user was infected and thus spread the virus to others, including the users as well as the workers and also their family members respectively, and a total of 50 people were infected. And also in Jeonnam province, in Yeosu City, in relation to a nightlife entertainment venue, we have seen one staff member there was infected, however, also continued to go to work, and a total of 64 people were infected there. So as for these two cases, cluster infections, people also had high risks of traveling of the respiratory droplets, including consumption of food and also consumption of beverages as well. And starting from July, we will also have the revamped social distancing scheme to be in effect. And to this end, we believe that there would be more people visiting these nightlife entertainment venues and pubs as well. So we would like to take particular precautions there. And it is very important that you comply with the basic quarantine rules. And if you have any suspected symptoms, you need to visit a screening clinic for testing. And also, you need to refrain from going to indoor multi-use facilities that are crowded and frequented by people. And when you are at indoor spaces, you need to wear face mask. You need to also minimize your time of stay there. And also when you are consuming food, you need to also minimize the dialogue as well. And as for workers and managers at these facilities, you need to also restrict the users if they have any clinical symptoms of COVID-19 and also have an entry log and also have regular ventilation. Moreover, starting from July 1st, we also have some detailed guidelines for mask wearing, and here are some details. Face mask wearing is the minimum way of preventing the virus and individually, and regardless of these vaccinations, it is very important that we need to wear a face mask indoors. So all of the people need to wear their face mask at indoors, regardless of their vaccination. And also at the other multi-use facilities like sports stadiums and also amusement parks and markets and traditional markets, all of the vaccine recipients, those who have received at least one dose, they also need to wear their face masks as well. So it is necessary for you to wear your face mask if you are visiting crowded places. And starting from July 1st, we also have the revamped social distancing scheme. Here are some words as for this new policy. And this revamped social distancing scheme is also aimed at minimizing the losses and the damages on our economy and our society. Nevertheless, even after the easing and relaxing of these measures, it is very important that we continue to comply stringently with the social distancing scheme that are in effect. As of right now, we also have global spread of the COVID-19 new variants, and in order to secure safety against these variants, it is very important that we comply with these social distancing levels. And the quarantine authorities will also carry out safe and speedy vaccination. And until we have the herd immunity, we will also exert our full efforts. Moreover, we understand that it is very difficult and challenging. However, we ask you to also continue to have a sense of public vigilance.
네, 그럼 지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Lee Sang-won with Monday's afternoon briefing, and I have Soa here at the desk with the gist of his address. Right, Soa?
Yes, there were a lot of announcements made today. First off, let's start with calling on vigilance on the people because of the social distancing measures revision coming up, and especially because he has been stressing that masks should be worn even with people who have been vaccinated when it comes to indoor facilities. And what's interesting in the past week is we have been seeing a 10.6% on-week increase in infections, but the number of infections among people aged 60 and above has been on the decline, while the number of people, younger people, patients has been going up, especially those in their 20s. So that's also something to notice. And quick update on the variant numbers. We've got 267 new variant cases, with almost 200 of those being local transmissions.
I see. All right, Soa, thank you very much for that.
My pleasure.
예방접종을 통해 중환자가 감소하고 있지만 아직 모든 사람의 감염을 막을 수 있을 정도로 충분한 접종이 진행된 것은 아닙니다.
1차 접종이 다시 본격화되기 전에 7월 중순까지가 방역의 최대 고비가 될 것 같습니다.
Our goal by July 4th is to have 70% of adult Americans at least one shot and 160 million Americans fully vaccinated.
The tools are vaccines, face masks and social restrictions with greater focus on individual responsibility. The threat is the Delta variant. And for more on the COVID-19 situation here and elsewhere, I have Professor Kim Moon-kyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
And I also have Professor Yu Byung-wook from Soonchunhyang University. Good to see you again, Professor Yu. Professor Kim, Korea's daily tally remained quite high this past weekend on the 600 level, and we're starting the work week quite high on the 500 level, as opposed to last Monday when we started on the 300 level. What are your thoughts on our current COVID-19 situation?
When we look back our data, we had 3 surges in Korea, and the first one was in February because of the Sincheonji outbreak, and if we look at the numbers of the incidence per million, it was about 12. And I guess the second surge was in the late August 2020. At that time, it was only about 6. And late December 2020, we had a big surge. It was about 20 per million. And after that, the number maintained between 9 to 10 per million. And the recent few days, it is rising fastly. So it's a concern. And still, people who finished vaccination is very low. And it needs 2 more weeks to be fully effective. And I think we don't have time to take a break. And the new variants, such as Delta variant, is another factor to impact on this point. So the socially active age group, they are not vaccinated yet, and they don't get severe, but they have potential to spread disease. So I think the only solution right now is the vaccinating people with an effective product.
Of course. And staying with what Professor Kim has just said, Professor Yu, the Delta variant, it's a universal challenge. What are your thoughts on its spread here on the local front?
Well, in Korea, so in incoming visitors more and more, because all the country, they are really relaxing of the social distance matter. Also, the border is opening. But this time, we cannot detect it 100% because health authorities say Korea is now early stage. Yeah, I 50% agree, 50% disagree. Because RT-PCR, we just confirm who has a COVID-19, yes or not. Cannot say about who had a Delta variant, yes or not. So, which means already, so in domestics, we found just few of the Delta variants we confirm, but probably around 3 months later, from now on, it will be a major variant will be in Korean Peninsula sooner. But don't be afraid about it. What Professor Kim mentioned about it. So inoculation process will be done in proper time, and young people wear the mask and to keep on social distance matter. Delta variants will be one of the change. It's like last year, S group, V group, RH group. We heard many times, but nearly gone. So Delta variant probably next year we will forget about it.
Hopefully.
Yeah.
Meanwhile, over in the US, the Delta variant is looking to take root as a dominant strain there by the end of July, with the proportion of new cases linked to it reportedly doubling every 2 weeks. For more on the situation in the US, I have Annalisa Morelli live on the line. Welcome, Annalisa.
Hi, how are you doing?
Good. Annalisa, just last month, the Delta variant comprised fewer than 3% of analyzed coronavirus samples in the US, but this month, that proportion has surged to 20%. What more can you tell us about the spread of the Delta variant over in the US?
Yeah, so as you mentioned, the variant is spreading quite fast, and some projections say that will become the most common variant relatively soon among the people who are infected. It is especially problematic because while the vaccination rates have been going up very quickly in the first few months, we're now hitting a slowdown, and there's some delays in the numbers of people that were supposed to be vaccinated by now and haven't, and so the virus is essentially finding pockets of unvaccinated people, where it can spread, more quickly.
And staying with vaccination, Annalisa, the White House has acknowledged that President Joe Biden's goal of offering one dose of the COVID-19 vaccine to 70% of the adult population may be, by the 4th of July, that is, may be difficult amid vaccine hesitancy. What is behind this public sentiment?
Well, that's what I was mentioning earlier. So at this point, pretty much every adult who wishes to have a vaccine can have it. It was the estimate of the White House that they would get 70% of all adult Americans vaccinated by the 4th of July. The latest data looks more like it will be probably around 67%. So it's not missed by much, but it is a missed target. And it is, which I think is pretty notable, the first missed target after a number of other targets not only had been achieved, but surpassed very quickly. So, the first 100 million doses were, administered much earlier than it was expected. And similarly, the following 100 million doses. So it is the first setback, and it's an especially troublesome one because it depends on people not wanting to get the vaccine. About 1 in 5 adults in the U.S. Say that they won't get the vaccine unless they have to. And so it seems that, sort of like the last mile will be especially difficult for the government to reach compared to the previous 70% in many ways.
I see. And moving on, Annalisa, the US FDA has added warnings about rare heart inflammation to Pfizer and Moderna vaccines. Could you tell us a bit about this, please?
Yeah, it is a warning that's been added to some heart conditions that can, inflammatory heart conditions that can develop after the vaccines in the days following the vaccine. They're extremely rare, and in most cases they're treatable. It's two conditions: pericarditis and myocarditis. As with every sort of adverse reaction and side effect that's emerged so far, it is extremely rare. It also it is the sort of a consensus in the FDA and the medical community that the benefits of the vaccine outweighs the risks. But they have added this is especially for younger people. So the majority of cases of this have emerged under 30, I believe. So really the youngest set of the population. And it's just something that people should be aware of. And, there's been a connection that's been established with these two vaccines. And so, they've released a warning.
Right. And staying with that, Professor Kim, for the sake of our viewers, do tell us a bit more about the myocarditis as well as pericarditis and the risks that they pose.
It's rare in natural world. There's about 2 peaks in the age. The first one is between 6 months and the other one is in the teenagers. And it's very non-specific. If the doctor does not have a suspicion of this kind of disease, it's very hard to diagnose. And these heart problems after vaccination, it's very non-specific symptom, and many times symptoms are 0 to some severe cases. Most common comes from the immune reaction after the virus infection or vaccination. Male is more common than female, and the age is between 10 to 30, and after the second dose it's much more common. Symptom is chest pain, getting worse if you lay down, and there's also fatigue and shortness of breath. We can make diagnosis by blood test, EKG, and also echocardiogram. The vaccine adverse event reporting system told us that we have about 1,200 cases out of 300 million doses. So it's very rare. COVID-19 is mainly infecting lungs, but rarely it can affect other organs such as kidney, brain, and heart. So we have to be concerned, but we are lucky that there's no report in Korea yet. In USA, it's said that it's a rare side effect and mostly mild, and there's also risk to have a heart problem with the COVID-19 infection. So the risk is higher than even the vaccination. So still we have to do the vaccination with these mRNA vaccines. And one more concern is that, is it safe to vaccinate those teenagers, I mean the age 12 to 18, but there's a debate about that, so we have to wait.
Right. Meanwhile, Annalisa, aside from public inoculations, what other measures are being adopted by authorities there to better contain the Delta variant that we spoke about earlier?
Recommendations to be safe. As you may know, the CDC lifted its mask mandate, earlier last month, I believe, and it still so in many places it's no longer compulsory to wear masks, but there's increased messaging that safety should be avoid wearing masks indoor. It is very unlikely that there will be further lockdowns, particularly not sort of like on a federal or like a large level. It is possible that where there's areas of increase, there's areas where the vaccination rates are lower than the average, or where the new cases are spreading particularly fast, that there might be some measures added then, but not on a countrywide level. And the president as well has said that he thinks it's very unlikely that will happen.
I see. All right, Annalisa, as always, thank you very much for making the time to join us live at this hour, and do stay safe.
You're very welcome. Have a good rest of the day.
Right, and back here in the studio, Professor Yu, on the local front, what is next on our vaccination agenda as we head into the second half?
Well, until now, we are very well done for more than 60 years old and the major risk group. Okay, second phase is young groups. Young group, until now, is announcement and incentive, and the benefits for the young people is working, because young people wanted it. They make the booking list for the rest of the vaccination. They want an opportunity to have rest of the AstraZeneca Janssen. We do that. But from now on, from the 18 to 40s young people, how we can make them understand to vaccinate it? Because young people, they do misunderstood that COVID-19, nothing for them. Yes, can be, but can be harm, as you know. So now some incentive, like 2 weeks the quarantine exceptions after the vaccination program. Also, there are no ban rule of the more than 90, more than 4 people are gathering, something like that. But more incentive we needed for now, because of little shortage of vaccinations. We are systemically rebuilding the system for having more people having the vaccination safely, and in the target until 70% of the Korean population. Measure is how we can make them to understand well of incentive and the safety measure to be followed this program.
Right. Professor Kim, as Professor Yu just mentioned, there is a lull in our vaccination campaign right now. As Soa mentioned earlier, we had 9 people who received 1 dose of the COVID-19 vaccine this past Sunday. This is making a lot of people worried about making the country vulnerable to fresh outbreaks. What are your thoughts on this?
What is our goal? If you are to suppress the mortality, it's okay to take a break. But if you are to control the number of confirmed cases, it's no good idea to take a break. You should have enough vaccine and continue as fast as we can to reach the certain level of herd immunity. If I say with caution, there is a high possibility that there might be a surge next month, even though there's no changes in mortality. So it's coming with easing the quarantine measures. So new information about Delta variant is pouring in, and which says it's more infectious, and we don't still know whether it's causing more mortality or not, especially for people who got vaccinated. So quarantine measures should be adjusted and updated according to these informations. And now they say that they're going to extend the pubs to be open until midnight, and all the cafes and those ideas. I don't know whether it's good. We might have to go back to 9 p.m. if necessary.
Right, and staying with that, Professor Yu, what are your thoughts on the timing of these eased social restrictions starting this Thursday?
Well, so releasing time is sooner or later. There are all the time criticized. Anyway, any condition. So which means time zone is started. So we should follow it because the few guidelines we started, every single time criticized about it. But now we have some weapon because vaccination. A part of vaccine is done. We're waiting for the middle of July to go to middle of September. Mass inoculation program is waiting for. But that time, young people, yes, people believe that, so this summer vacation better to delay, better to waiting. But anyway, young people go to vacation. Right. So social distance matter, keep on the mask. And if you could on the self-quarantines, will be safe because we knew already and waiting for your vaccine program. Anyway, time is started. So 1st of July is new social distance matter started. But what is now responsible? So governments give a guideline, people how to follow it, and depend on our responsible social distance matter what Professor Kim mentioned, could be higher or keep on down, it depends on us.
Right, depends on our individual sense of responsibility. All right, Professor Yu, thank you very much for your thoughts. And Professor Kim, thank you very much for being with us here today.
Thank you so much.
Right, now do seek COVID-19 testing should you feel that you may have been exposed to the virus, and do seek to keep your face masks on at all times, as Professor Yu has said, when you're outdoors. Thank you for watching.